Well, thank you. Thank you for joining all of us today as we discuss Black health empowerment, advocating for yourself, and advocating for your community. Health is collective, health is cultural, and health is generational. And when you empower yourself and take care of your well-being, you strengthen your family, you uplift your community, and you actually lay the groundwork for future generations. At Pfizer, patients are at the heart of everything that we do. And that's from the earliest stages of our development, through clinical trials, through the approval of our medicines, and all the way through the use of our medicines. We are listening to patients, patient advocates, and caregivers. And we have been doing this at Pfizer for 175 years. And our work doesn't just end with the innovation and the science. It's all about doing work with patient advocates around public policy, which I know that you've heard a lot about today, and also social impact issues. And this conversation is important because so many of these issues disproportionately impact African Americans. And we're aiming to close this gap by helping ensure that you have the resources you need to advocate for yourself and your loved ones. So let's get into it. It's important for us to center the patient in everything that we do. And with me today, we have three phenomenal panelists who are dedicated to advocating for Black health after their own personal experiences with healthcare. Please note that these panelists are being paid for their time. Their views are their own and do not necessarily reflect Pfizer's views. So I'm going to one last time introduce our phenomenal panel, and then we'll get into the conversation. So we've got LaToyia Dennis, who is the founder and CEO of the nonprofit A Chance to Learn. She founded her nonprofit, which focuses on transforming the lives of children and families through comprehensive early education, empowering parent engagement programs, and essential perinatal health support. And we've got Candace Henley. She is the Chief Surviving Officer and founder of the nonprofit Blue Hat Foundation. She founded the nonprofit after being diagnosed with colon cancer at age 35 to raise colorectal cancer awareness in communities of color through culturally relevant education, storytelling, and advocacy. And we have Khadeen Ellis. Khadeen is an actress, podcast host, wife, and mother of 4. She's openly shared her personal health journey and how it shaped her advocacy for mental health support and maternal self-care. So, each of you women has a personal story that is fueling your drive to help others. LaToyia, let's start with you. Can you tell us a bit about your health journey? And it'd be great if you could share a couple of pivotal moments that you had along the way.
Yeah, absolutely. Hey, beautiful people. So advocacy saved my life twice. I had 5 miscarriages, and the 5th one nearly killed me. The hospital said had I made it to the hospital 5 minutes later, I wouldn't be here. So my husband and I decided that we didn't want to have children, and a friend recommended we see another doctor. Upon our first visit, she phoned my doctor and said, "Did you happen to do an autopsy on the fetus to determine why she had miscarried?" I didn't know you can do that. But she ran a series of tests on my body to determine that I was miscarrying because I lacked progesterone, and the baby needed the progesterone to live. So we got pregnant, she prescribed progesterone, all was well. Fast forward 3.5 months into the pregnancy, I started having miscarriage symptoms again. We go to the hospital and they say, "You've lost your baby. You need to go to the doctor to get a D&C." We go to the doctor. My husband was in the room, advocacy number 1, in the room, and my doctor said, "Well, LaToyia, I'm so sorry. Let's just go across the street to do the D&C." And he said, "Can we not do a D&C? It'll be the 6th D&C within 2 years. We don't know what that's doing to her body." The doctor said, "Well, if the sac is intact, we have to do it. But if not, she'll be fine, it'll pass." They did a vaginal sonogram to find that the hospital had made a mistake. There my baby was, kicking and moving. And had I walked across the street, I would have aborted my baby. We named him Chance because God gave him a chance at life. Thank you. Fast forward, you guys, I am on bed rest, diagnosed with gestational diabetes and preeclampsia. Had an emergency C-section nearly 2 months before Chance was due. We were fine in the hospital about 7 days. Not even 7 days after being released, I'm in the bed laying down. My body starts seizing and releasing fluid. Advocacy number 2, my husband called 911 and they said, check her blood pressure. He did, it was high, gave me apple cider vinegar and water. I find out that I nearly died. The leading cause of death for Black women postpartum is gestational diabetes and preeclampsia. And what happens is your body starts seizing, releasing fluid, and you die. Advocacy is so important. It's so important for us to have somebody in the room. And if we can't, ladies, make sure that you're asking questions, not until you get an answer, but until you understand. Ask about that morbidity and what it means. And then write it down. Take notes, not to build a case, but to better advocate for yourself. Should someone else go with you, you'll be able to tell them exactly what the doctor said. So it saved my life twice.
Thank you, LaToyia. And I'm gonna repeat what you just said. Ask questions, not just until you get the answers, but ask questions until you understand. That's how you advocate for yourself. And then the second thing that we heard is that if possible, have an advocate with you, in person or on the telephone. And I'll say we have at Pfizer a couple of different tools that help you advocate for yourself. We've got a doctor discussion guide that is on our platform, PfizerForAll.com, where you can anticipate questions that you should ask your doctor. And for those who want to go down the hall to the Pfizer booth, we've got health journals so that you can document some of your health information.
They're super cute. You should go grab one.
And then I'll just ask Candace real fast, you've also got some thoughts about how to record your health information.
Oh, absolutely. So often there's a tool that we're not utilizing to the fullest degree, and that is your patient portal. The patient portal is a very important tool that you can use to communicate with your doctor, even when you can't get them on the phone. And a lot of times they usually respond a lot faster through the patient portal than they do on the phone. So utilize those tools and make sure it keeps your summary of your doctor's visits as well as any medications that you have. So it's a very useful tool to communicate any questions that you may have after your visit.
Great, great. And Khadeen and I were having a side chat over here because we both use our patient portal. Patient portal. So, Khadeen, what did your childbirth experience teach you about advocacy?
So I have 4 sons, and it's funny, I always knew that I wanted to be a mother. That was at the very top of my list before everything else. And when I started dating my husband, and of course we got married and decided to have children, I was so impressed, and it was actually kind of romantic to see how invested he was in the process with me. So he was doing a lot of research as my spouse because he really genuinely wanted to understand everything I was going through in this moment, right? It was our first time having a baby, first time pregnant, experiencing this together. So I was really impressed to see that not only was he reading the books with me and watching the videos, but he was doing it on his own as well, to the point where there were certain things happening to my body or I was feeling, and he would like jump in and say, hey, that's happening because at this phase, the baby needs this and you need more of that. So it was just really, really nice to have someone who was so invested in the journey alongside me. And it became very important how that process and how he showed up for me. It became so important after having my first son because we got to the hospital, I was induced, I had elevated liver enzymes. So because of that, and they didn't know where that was coming from, I had to be induced. After getting a really botched epidural job, I delivered my son. And after the baby was delivered, a lot of the attention went to him because we knew in utero that he had a clubbed foot. So the doctors, a lot of the pediatric staff went immediately over to the baby, but my OBGYN had stepped out of the room for a moment, and my husband noticed that I was bleeding profusely. And he kind of summons to my mom, who's also a nurse at the time, and she's like, that doesn't look normal. So both my mom and my husband went to get the doctor. I was literally bleeding out at this point, had to go under emergency surgery, which was of course super scary because you make a birthing plan and you think you know what's supposed to happen, and then when the unknown happens or that rare situation happens, it's very off-putting, and of course it's scary. So when my doctor finally figured out what happened, it turned out that I had an internal vaginal wall tear, and I had to get 27 stitches in order to stop the bleeding and to pretty much be mended together again. So after that, I realized, had my husband and my mom in that moment not been attentive and not went to call for the doctor, I would have been borderline transfusion or having to stay in the hospital for a longer amount of time. I didn't spend the first day with my baby because I was in recovery after surgery. So in that moment, because I could not advocate for myself, it really let me know the importance of having a spouse or a family member who was able to advocate for me. Fast forward, after baby number 2 and number 3, I had baby number 4 at home with a midwife. And that was a really great environment because it was at home. It felt very natural. I had gotten over the trauma of the first baby because clearly I had 2 and 3 and 4.
So proud of you, by the way.
If I was that traumatized, Jackson would be an only child, you know? But I went back again and again and again. So after my 4th son, I then found myself in another situation where I had to, again, have someone advocate for me. I had a severe headache postpartum, 9 days, thinking it was just fatigue. I'm tired. I had a baby. I'm up nursing at night. Then this headache wouldn't go away. My midwife was like, FaceTime me. Let me see your hands and your feet. They were swollen. Check your blood pressure. My blood pressure was 202 over like 197. It was ridiculous. So I was borderline seizure, had to be rushed to the ER. In the ER, my husband was then again rallying behind me to make sure that the hospital staff was attentive because far too many times Black women end up in situations where they write off a headache and just say, you're just tired. Oh, that's normal. That comes with the territory. And it let me know in that moment that these things are not normal. And I'm happy for spaces like this. So thank you to Pfizer and to you ladies for giving us a space to have these conversations.
No, and thank you for that. I mean, what a story. And you know, you said a couple things about advocacy. First of all, you have an advocate who was along for the whole journey, right? A very educated advocate in your husband, but as well as your mother. And an advocate who helped you get past second guessing what things might be, or others in the room helping second guess, because I do think it's human nature to say that's that's nothing at all. So having an advocate who's like, no, I know you and I know the situation. So yeah, so thank you. So Candace, let's move over to your story.
I'm here.
It's a little bit different.
Yes.
When you were diagnosed with colon cancer, you were 35 years old.
Yes.
And a mother of 5 children.
Yes.
Most people think that colon cancer impacts older men.
Yes.
So what is it that you want the folks who are watching virtually and the folks who are in this room to understand about colon cancer?
Well, first of all, it is uncommon to be diagnosed with colon cancer at 35. And for me, I was preparing for my first bodybuilding contest. And so I want to say to you that you're healthy until you're not. And so often we walk around thinking that we're healthy and everything is well, but then we don't realize that we may have a family history like colon cancer. I didn't know that I had a family history until 11 years later. And we don't know the signs and symptoms. Colon cancer is very prevalent in the Black community. We have the highest rates of diagnosis and death of colorectal cancer in more than any other groups. So we're not aware of screening, when to be screened, which is 45, unless you have a family history, which is 10 years before the age of the person that was diagnosed. So I was diagnosed at 35. My daughters had to be screened starting at 25. Do your research. Learn what the signs and symptoms are. Know what colon cancer is. When I was diagnosed, I didn't know what colon cancer was. And unlike these ladies, when I was diagnosed with colon cancer, I didn't have someone for me to speak. I had to speak. That was me. And so often we find ourselves in situations where we're the only one in the room, and so then we have to make choices. And so make sure that you're making informed choices. I was rushed through the process. If you don't know something, don't let them rush you through the process. Say, wait a minute. Give me a minute. Let me Let me understand what you're saying to me. And if you're not satisfied with that, tell them, wait a minute, let me get someone with me. Yes.
Yeah,
So we have to advocate for ourselves.
Yeah, because you do sometimes have to self-advocate. And when you do self-advocate, you really do have to use your tools.
Yes.
And I know that Blue Hat has tools. I know that A
Yes.
Chance to Learn has tools. Pfizer has a cancer tool that's called This Is Living with Cancer,
Yes.
where you can get pre-information.
Oh, absolutely. And I advocate, write it down.
Yes.
Write it down.
Write it down. Okay, thank you. So, Khadeen, during your childbirth journey, you developed preeclampsia postpartum. So what did that teach you about the pregnancy process, and what do you want folks in here to understand?
Absolutely. So if you're planning to become pregnant or happen just to become pregnant, I think there's a lot of focus on the first 3 trimesters, right? You hear first trimester, second trimester, third trimester. But far too often I'm finding, as I speak to other moms who are first-time moms or just vet moms that are like, these are the things I didn't know about. There's something we call the 4th trimester. And that is essentially the time once you deliver the baby up until at least 6 weeks postpartum. And what most people don't know is that's where a lot of things can go wrong. So to LaToyia's point, as well, not knowing that gestational diabetes, postpartum preeclampsia, people don't know what these things are. And it wasn't until I started to share my story publicly that people said, oh my goodness, I had no idea there was a possibility that after having the baby, things can go awry. I could potentially lose my life, not just during childbirth, but after. So let's start talking more and letting people be aware of and informing people of the symptoms to look out for. Nausea, high blood pressure, headaches. There are all of these telltale symptoms that one will experience that can literally let them know these are the red flags that are associated with postpartum preeclampsia or gestational diabetes.
Mm-hmm.
Wow, thank you. And you shared a term that I was not aware of, and I have 2 children, which is 4th trimester.
Yeah.
And I think it's just so important for those of us who've had kids and those of us who haven't to look out for the women in our lives and to keep our antenna up for symptoms and make sure that they're aware of the symptoms.
For sure. And just by having the conversation, I've had people write into my podcast or to DM me and say, I experienced the same thing, and at the time, I didn't know what it was. Or I experienced this, and because I heard your conversation, I knew to then say to my doctor, can you please check for this? Mm-hmm. And those are life-saving tools and techniques, for sure.
And you know what? Not only that, it's so common, right? You hear about preeclampsia, and so many people have it. So we think it's just, a general morbidity. But with women of color, it can literally kill you because it's just high blood pressure. And so, to your point, just making sure that you get checked prior to being dismissed, because it is the leading cause of death postpartum for Black women.
Yeah, thank you. And I think that this is a great segue just to talk about community, right? So after all of these experiences that we've had a conversation about and the experiences that you all have encountered, what advice do you have for everyone in this room about actually elevating these issues within our community?
Well, I'll definitely tell you, for one of the things is colon cancer has always been looked at as a taboo topic. And it wasn't until after I started sharing my story and sharing not only, was I 35 with colon cancer, but actually sharing that I was misdiagnosed for 6 months, right? And so often, again, not knowing how to advocate for myself, it was just like I went through the process. But then when I started talking about it, my family members started talking about it. And so when we started our event to raise awareness for colon cancer in church, we had on our blue fabulous hats. And my family members, it was kind of like, the herbal essence effects, right? They tell 2 friends, they tell 2 friends, right? So when people were asking, like, why do you have on those blue hats? My family said, oh, March is Colon Cancer Awareness Month. She's a survivor, and we're wearing this in honor of her. But what it also did, it also prompted other people to start telling their stories of other family members who had been diagnosed with colon cancer, who may have passed on from colon cancer, or who was currently living with colon cancer. So when we share our stories, we're prompting other people to finally speak and to say, oh my God, this happened to me, or that happened to me. And it's that commonality. And when people looked at me, they were like, you couldn't have possibly had colon cancer. I did. But then when I shared the other piece of it, of my financial and the homelessness that I experienced, people came forward and said, thank you for sharing that because that happened to me.
Yeah.
So it can free other people who are looking for stories that resonate with them.
I agree. Thank God we don't look like what we've been through, right?
Absolutely.
Really. We overcome by the power of our testimony, and you talked about storytelling, but I do think it's important for us to share our stories. For me, it's been the countless moms that, we did a 50-city tour over 2 years, Maternal Outcomes Matter. It's been the countless moms that have talked to me about, you shared your story and I ended up being diagnosed and I demanded that they test me prior to being, released from the hospital, and it saved my life. Or, the community organizations that are on the ground doing the work, like supporting doulas. I think we can all play a part in advocacy by supporting organizations that are already doing the work.
Yes, and I love that you've both brought up destigmatizing elements of stories, which is really important, right, Khadeen?
Oh, my
Absolutely.
goodness. Yeah, it's so important. And I think just being in a space and in a forum like this to share publicly, another added layer to, of course, being informed and having resources is also just not feeling alone. Think about how many people are going through something health-wise that you feel like you're silently having to suffer and you don't have a community to support you. So by sharing in spaces like this and being a bit vulnerable and sharing your testimony, that might encourage someone else to either go get checked, to be of support to a family member, to share a bit of the family history that they have, to prevent future generations from suffering from the same thing. And to touch on community, even for postpartum moms, if you don't have a village around you, because we know how important it is postpartum to have people close by, sometimes there are people who are professionals that you can lean on for support. There are doulas, there are night nurses, people who you can kind of cherry pick to build your village so that you're in support to get through the difficult times.
Yes.
And thank you for doing a podcast, because that's a village unto itself, right?
Indeed,
For folks who might be
yes.
isolated.
Thank you.
It
Ellis
feels
Ever After.
very-
We talk about so many different things, but we're very, very, very much on health, wellness, and all of the, components that are involved in that.
I want to interject on that too, because while we're talking about family history, we have a tagline called Family Secrets Kill Families. We are a family full of secret keepers. And how many times have you all heard what goes on in our house stays in our house?
Yes, yes.
So that means everything else to go along with it. That means health, that means anything else. And so we wind up having family history of diseases that no one is sharing. And so what I want to say to you is, stop that cycle, because what you're not sharing with your family members can kill your children. It can kill your grandchildren. So think about that. You might think that what you're going through is your business, but think about, what if your child may be diagnosed with cancer and you didn't tell them that that's what ahead of them? I wish I knew. I would have gotten screened 10 years earlier had I known that I had a cancer, in my family. So then that would have prompted me to be proactive. So knowing your family history causes you to be proactive.
Truth. Thank you, Candace. Well, we're on our last question, and we've talked about some heavy things, right? We've talked about increasing rates of cancer, and we've talked about barriers to care. Let's end on a higher note. And I want to know for each of you, what keeps you motivated, hopeful about the future, and excited? And maybe we'll start with Khadeen on this side.
Yeah. All good. Oh, what makes me hopeful for the future? I think it's existing in spaces like this. We're talking the talk. We're having the conversation. The cat's bag. There are no more secrets. And I think by creating safe spaces, right, to have these conversations, more spaces and arenas like this need to exist. So if there is something in your family that you realize several family members have been dealing with a history of a particular cancer, maybe getting a pool of people together who can speak about their shared experiences and then essentially sharing those resources. Yeah. Because once you have the resources, you have the knowledge, you have the information, you are more well-informed as a patient going in to see medical professionals and saying to them, here's what I've gathered, here's what I've been experiencing. Now, how can we bridge this gap? And it gives kind of like an an unspoken accountability system that we have between patient and provider. So that way we feel like we're a team working together for the good of our health versus being on opposite sides of the spectrum. It gives a bit of a checks and balances system as well to make sure that I know what's happening. I'm going to lean on your medical professional opinion, of course, but at least I can process this information and understand it. So here's to more spaces like this where we can speak and share and love on each other in real time.
And I love when we do events like this, we always think about, oh, this is my idea for the next thing, right? So it's catching. Yeah. When we engage like this, it's very catching.
Absolutely.
Okay.
Yeah, for me, it is the countless moms that can't speak for themselves, right? It's a rarity that I'm alive. Most women didn't make it, and so having the opportunity to speak on their behalf, having the opportunity to be the mother to my chance to be a mom, he's in the audience somewhere, but then also, just being able to partner with corporations, communities, organizations that are doing the work, like Pfizer having us here today. It's important for us to have advocates in partnership. And so that motivates me to keep going too.
Yeah, here's to partnership.
Yeah. Research has allowed me to be here. The research is something that's very important. I just want to say, don't let cancer kill you. Don't let fear of cancer kill you. So often we don't get checked because of fear. Also, the research has allowed me to see more birthdays, more anniversaries, and it has allowed me to see my grandchildren. I have 4 grandchildren. And so cancer is not necessarily a death sentence. The sooner you get screened, the better you are, and the more life you can live. So that's what makes me happy about the future.
Thank you.
Amen.
Yeah.
Keep on.
I was just saying
Okay.
amen.
Yeah.
Yes, and I was just going to say, Candace, I'm so glad you brought up the research and innovation because that's what keeps me excited is how phenomenal the science is that is coming our way in the future. Yes. But the work that each of you 3 is doing is also around making sure that the existing therapies that we have even before the new innovation get to the patients that need them. So I cannot thank each one of you enough for sharing your stories. You all gave us incredibly practical information to go out of this room with. So there are a couple things I wrote down that I want to make sure we say again. One is get screened. There are screening guidelines for different cancers at different ages and many resources for you to find out at what age you should be getting screened. The other is document your health. So go down the hall and get the Pfizer Health Journal that's at the Pfizer booth. Ask until you understand. Don't just be quiet when you've gotten an answer if the answer is not something that you understand. Advocate for yourself and advocate for your friends. And talk to your family. Family secrets kill families. Thank you. Thank you for all of this knowledge. And on behalf of Pfizer, I want to thank the panel.
And thank you, Angela,
Thank
for being an amazing moderator. Give it up for Angela.
Amazing.
And the entire Pfizer team. They've been awesome to work with. So thank you so much.
Thank you, Pfizer.
And thank y'all for being here.